Hello, and welcome to another edition of For the Health of It, a new segment on health and wellness dedicated to getting important health information out to you and our community. We have a very important topic. I'm your host today, Pastor Trevor Kinlock. We have an important topic today that we want to share with you that is very serious. It is Black mothers and mortality rates. The mortality rates of Black women, of Black mothers. We have our resident healthcare professional with us, Dr. Laverne Bruce. Dr. Bruce, it's good to have you again to talk about this very serious and very important topic.
Thank you so much for having me. It's always a pleasure.
All right. So let's get right into it. Dr. Bruce, why is there a crisis in the Black community with maternal deaths?
Well, maternal morbidity or maternal deaths constitutes a very, very serious issue. To get to the heart of it, let's begin with a story. About 4 years ago, two very prominent Black women in our culture discussed their own personal crises during their pregnancies. Serena Williams, the tennis superstar, described that she had blood clots in her legs, which went to her lungs. Now, as we know, pregnant women do tend to have what we call hypercoagulable blood, in that their blood has a higher tendency to clot. And then also pregnant women tend to be less active. All of these factors lead to this increased coagulability. She described having to push her healthcare team very, very hard in order for even to do the significant testing, a CT scan, which actually diagnosed that she had this problem and potentially saved her life. The other person was Beyonce Knowles. During her pregnancy with twins, she described developing something called toxemia of pregnancy. The medical term is preeclampsia, and it's characterized by a triad of symptoms which are very easily recognizable. One is a surge in blood pressure. Two is the development of protein leaking into the urine. And three is the development of something medically called edema, which really is swelling, generalized swelling and fluid retention in the body. Fascinatingly, Beyonce described growing to 218 pounds. And normally she's a size 4 to 6. So that must have been quite a significant change in her body. Now, toxemia can be fatal if it's not treated. And removing the babies actually cures the problem. So she had to have an emergency cesarean section to remove her twins and save her life. Now, just a little aside, it's called preeclampsia, but eclampsia is when the fluid situation is so bad that even the brain swells and the pregnant woman can have seizures and die. Now, both of these women are two actually of the wealthiest and fittest women in the world. Yet still, they had these pregnancy-related problems, which were, well, I can't really say because I wasn't their physician whether it was caught in time, but these pregnancy-related problems which were potentially life-threatening.
I'm sorry, go ahead, Dr. Bruce.
No, this translates to a large number of women in the United States that we will discuss during this conversation.
So I think that what you just shared, what is concerning is, again, these are women that are quite wealthy. These are Black women that are but yet they still had to press their healthcare professionals to get the care that they need. And we know, again, it shows up over and over again in the data how Black women and Black families in general don't get the same quality of care. And so just the importance of being your own healthcare advocate, making sure you know your body and that you press and advocate for yourself. So I think that's fascinating, something that you just shared and pointed out there about these two ladies. What are some of the statistics around these mortality rates with Black women in pregnancy? What are some of the statistics that cause alarm?
Dr. Kinlock, these statistics are actually terrifying. Now, for example, in the United States of America, maternal mortality is described in terms of deaths per 100,000 births. And in the United States, the average for 2019 was 20, which rose to 24 in 2020. Now, if you do a ranking of the world, you will find that the 10 best countries have a mortality rate that's between 2 and 5 per 100,000 births. In the US, we are 24. Do you know what number that puts us at? That puts us at 58. We are doing worse than Kazakhstan, worse than Uruguay, worse than Moldova,
Wow.
and yet we're one of the most developed countries in the
Mhm.
world.
Mhm.
When you look locally, that number is even more terrifying
Mhm.
because Black women have a mortality rate that's about 3 times the rate of white women. So if you pull just the Black female group out of that group of 20 per 100 deaths,
Mhm.
your number actually goes up to about 45.
Mhm.
And if you look at the District of Columbia itself, where Black women make up about 50% of the population, you'll find that Black women in the District of Columbia make up 50% of the births, but 90% of the deaths.
Wow.
And those are terrifying
Those
numbers.
are alarming. Those are alarming numbers to hear. And I would imagine that these statistics are kind of repeated in our cities, our communities all around the country. So this is not just like a localized issue. This is of concern for the entire country.
I would say yes.
Hmm. Well, what are some of the factors, just in your professional opinion, what are some of the factors that are feeding into this problem?
Well, obviously, this is going to be very, very multifactorial because it is such a serious and such an important problem. So, and it constitutes a constellation of not only medical, but social problems as well.
Hmm.
So, of course, one cannot ignore the impact of poverty. If you are homeless, you're not going to get prenatal care. So, one of the biggest problems is the absence of early prenatal care, which tends to be more common among poor people. Lack of access to prenatal care. For example, here in the District of Columbia, where I live, the southeastern quadrant of our city is very lacking in access to prenatal care and in hospitals for delivery.
Hmm.
So it's a medical as well as a social problem.
Hmm.
But there's one interesting factor that some scientists have mentioned, and they have found out that even wealthy, educated Black women still have a higher risk, for example, of premature births and of other medical problems which are life-threatening.
Hmm.
And their theory is that just the stress of being Black in America contributes to that.
Mm. Wow. Wow. So, I mean, these are sobering numbers, sobering statistics that are coming out just with regard to this this reality of mortality rates with Black women. All right, so we've heard a lot of the difficult news, the hard, sobering facts. So, what do we do about it, or is there anything that we can do about it?
There's always something to be done. Once a problem is recognized, there has to be a solution.
Hmm.
So, for example, hospitals are talking about better recognition, paying more attention to patients, recognizing that there may be cultural differences in how you understand the patient's complaints of pain or of a problem, enough to pay attention to it, implementing better safety protocols. And then, of course, on the social slash political side, one can push in communities for better access to healthcare, clinics, more clinics that are affordable, more hospitals that are affordable. And then, of course, everyone must have some degree of personal responsibility. So, Black female patients who are pregnant must pay attention to making sure that they be more assertive about access to healthcare if it's very difficult to obtain.
Hmm.
Um, Educating themselves about nutrition and how they should treat their bodies.
Hmm.
And basically, self advocacy is also another very important aspect. But obviously, there's so much to be done, and I can't even begin to cover the entire issue. This could take an entire day's worth.
Certainly, but I think what is important is that we are not helpless to these statistics, to these numbers. That we have some power, some agency to be able to shift the narrative, shift the dynamic. Certainly on the broader social level, but also on the individual level. And so,
Absolutely.
as you're talking to Black mothers, you have just shared a number of things that Black pregnant mothers can do to ensure that they are never a part of this statistic.
Correct.
All right.
Educating yourself as to how your body functions and
Mhm.
what you need to do to grow a healthy baby is very, very important.
Awesome, awesome, wonderful. All right, mothers, fathers, everybody out there, we can do something. We are not bound by these horrible statistics, but we can actually help better our chances and better ourselves by the practical wisdom and advice that was just shared by our very own Dr. Bruce. So I want to thank you all. If this was informative, if this was helpful to you, or you know that this can benefit someone, please be sure to like, to share, to subscribe, to get this out. We want to make sure that we are educating as many people as we can, because we do know that when we do that, we are making a difference in our community. We're blessing one another, and we are ultimately being our brother and our sister's keeper. So, Dr. Bruce, thank you so very much for sharing this information with us again. And to everyone, this is another episode of For the Health of It. May God bless you. And as always, no matter what, keep the faith.
Thank you for the privilege, as always.